Welcome to this micro-learning seminar. There's going to be 3 micro-learning seminars in this session. My name is Leah Desormo. I am an MSW intern with Amber Sperling Social Work and Psychotherapy Services. Just a little background, we did complete some interviews with some mothers back in November and December of last year. And some of the feedback that came through from those interviews were moms looking for some of these quick micro-learning seminars on various topics that they could watch at their leisure. So I will be doing 3 seminars on navigating anxiety, overcoming guilt, and understanding identity shifts. They will all be posted, and then I will be doing a live session on March 4th where people can come and we can talk about the sessions, ask any questions, anything like that. So that's the purpose. So the first one, and also these seminars are, my hope is they're about 20 minutes in length, so they're not too long, that you can just pop on and kind of watch them. Write any questions down that you might have or any concerns, and we can answer those at the live session on March 4th at 12 p.m. So this first one is navigating anxiety during the postpartum period. So understanding it, coping and seeking help. So what is postpartum anxiety? So the official definition is obviously anxiety that occurs after childbirth, affecting physical, emotional, and mental well-being. So some statistics in Canada, almost 1/4, so almost 25% of mothers who recently gave birth reported feelings consistent with either postpartum depression or an anxiety disorder. The proportion of mothers reporting these feelings varied across different provinces. And I would kind of challenge that statistic a little bit, just in terms of these are mothers that are reporting feeling this way. So as we know, there's lots of people who aren't reporting it, who aren't talking about it, who are kind of living with it and not really saying anything. So my thoughts are that that statistic is probably a little bit higher. So the importance of addressing it, it can impact overall well-being in your parent-child bonding. Common symptoms of postpartum anxiety. So obviously physical symptoms we may have are rapid heartbeat, shortness of breath, muscle tension, headaches, fatigue, or trouble sleeping. Those are big ones. Emotional symptoms, constant worry, fear, unease, feeling overwhelmed or out of control, irritable or agitated you may feel like it's no reason, like I just feel really irritable today, can't really pinpoint why. That could be anxiety. Behavioral symptoms, avoidance of certain situations. Maybe that looks like social settings. You want to go out, but it's really challenging to go out to different groups or social event. Overprotectiveness of the baby. So obviously as mothers, parents, we of course are protective of our baby, but there could be an overprotectiveness, meaning you just don't want to take the baby out at all. You don't want anybody to hold the baby, those kinds of things. And obviously difficulty relaxing or staying present. So those are some of the behavioral symptoms. So what causes postpartum anxiety? So there's lots of different factors. And again, back to that statistic, 23%, I would probably think it's more 35%. So postpartum anxiety is actually really, really common. It's not talked about enough, but there are hormonal changes. So fluctuating levels of estrogen and progesterone after childbirth can really affect your mood. So we know these hormones rise and fall. If you're breastfeeding your baby, then those levels are higher as well. So if you stop breastfeeding, that can change. When you stop breastfeeding, those hormone levels will drop, and that can affect it. But after childbirth, your hormones are kind of all over the place. So it does take a while for those to kind kind of get back to normal levels. Physical stress, so obviously just the recovery from childbirth. Even if you had a fantastic childbirth, that is still a lot on your body, and it does take time to recover. Even if you had a C-section birth or you had a vaginal birth, it's just a lot on your body. Sleep deprivation, we know, obviously with newborns and little ones, they're up at night. They have to get on a sleep routine. That can be really challenging. So sleep deprivation is kind of one of the biggest factors to having some anxiety. The demands of caring for a newborn can also contribute. So especially if it's your first baby, there's a lot to learn and a lot to know, and they don't come with a manual, so we're kind of figuring out as we go. So just caring for a newborn can cause and contribute to anxiety. So psychological factors. So previous history of anxiety or depression. So mothers who have experienced anxiety or depression prior to getting pregnant and having a baby, they're at a little bit higher of a risk of having that after childbirth. Fear of not being a good enough parent or experiencing the pressures of motherhood. So again, there's a lot of pressure on mothers and fathers, but specifically mothers, to be the best mom, to be the best parent. So those just pressures coming from everywhere in the world can contribute. External stressors, so lack of support, financial stress, or relationship challenges. Any of those, obviously, financial stress, you could be on maternity leave, which typically is a decrease in your income. That can cause stress. Lack of support, so if you're kind of doing it on your own, not a lot of natural support or informal supports, that can make it challenging. And then obviously if you're in a relationship and there's challenges going on, that can cause that as well, or can be a factor, sorry. So what's the impact of postpartum anxiety? So on the parent, can affect daily functioning, relationships, and your self-esteem, may lead to feelings of guilt or shame about not being able to enjoy the experience of motherhood. On the baby, it can impact bonding and attachment with the baby. Anxiety can manifest in behaviors like over caring or withdrawing. So again, this is not in every case, but it can sometimes look like we talked about, you're over caring, you're not letting anybody near the baby, not letting anybody hold baby, not going out with baby, or you could be withdrawing from baby. Both of those things can sometimes impact attachment with baby. Not in every case, but just something to be aware of. On relationships, obviously there could be a strain on partnerships due to emotional distress, changes in intimacy, or lack of support. So what do we do? So this, all this information is helpful in understanding where it might be coming from and what it may look like. So what are some coping strategies, treatment options? So a really great one that we recommend a lot for individuals is sensory grounding. So there's lots of different grounding exercises and techniques, but one that's kind of really quick and something that you can do kind of anywhere at any time. So it's 5 things that you can see, 4 things you can touch, 3 things you can hear, 2 things you can taste or smell, and 1 thing you're grateful for. So what that does is just kind of shift you away or out of that, out of those feelings of anxiety, right? So it's just a quick looking around the room. 5 things I can see right now, right? I can see my computer, I can see my TV, I can see my a pen that I had, or my notebook, or just you kind of name them. You can name them in your head, or you can do this out loud. 4 things you can touch. So those ones are really important for people that touch is a big piece for them. So if you're sitting on your couch, I'm touching the couch and it's really soft and I really like the fabric. Or I'm touching my dog, I'm petting my dog, and their fur feels really soft to the touch. Just kind of name those things, right? It gets you out again into the present moment. 3 things you can hear. I can hear a snowblower outside. I can hear my coffee maker going, those kind of things. Two things you can taste or smell. So again, I can taste my coffee that I'm drinking. I can smell my lip balm that I just put on, or I can smell muffins that I just made, anything that you can smell in that moment. And then one thing you're grateful for. So that's a really great quick one that you can try. Again, anywhere. You could be in your car, baby's crying or fussing in the car, or you're worried about where you're going. Maybe you're going out to a social event and you're having some anxiety with that. You could do this in the car on the way there. So that's a really great one to try. So medication, there are some great anti-anxiety medications or antidepressants that may be prescribed by your doctor if necessary. So those are kind of a great way to kind of help help your body while you're trying other things as well, right? So if it's pretty extreme, then I would recommend you obviously talking to your doctor and maybe starting on a low dose of something in connection with some sensory grounding, some support, some counseling. Like it, people think, oh, they're just going to prescribe me medication. Yeah, that's kind of like one piece of a treatment option, right? Medication is kind of to get you to a place where you can start to look at other different treatment options and enjoy those, right? So think of, medication as just a piece of the pie. It's not the whole pie, and it's certainly not going to be a magic cure for everything. But if it is pretty extreme, then it is a good idea to kind of talk to your doctor about that. Obviously, support groups and peer counseling. Support groups are really lovely. A great way to feel connected and feel like you're not alone, and feel like there are other people going through the same thing you are. So a sense of community can be really helpful. Yeah, they can also offer a safe space, share experiences. They can share things that they've tried, different advice, that kind of thing. They can also get you out if they're an in-person group. That's always helpful too. Sometimes virtual is obviously wonderful, but it is important sometimes to get out of the house and go to things in person as well. Self-care and rest. So, self-care is a very big topic. Could probably do a whole presentation on it, but self-care, doesn't necessarily mean, you need to have a bubble bath every night. That's not what that means. Self-care can look like anything that you do that helps you or you find joy in. So that could be binging a show on Netflix, or going and getting a special drink, a latte or something, if that's what you enjoy. Yeah, it can look like all different things. It doesn't have to be what we typically think of with self-care. Obviously, prioritizing your sleep, even if that means accepting help from others. If you're not getting proper sleep, the rest of this stuff is really going to be hard to do, right? So that may mean accepting some help to say, I really need to get my sleep back on track. So can you come and help me with that? Or can your partner or somebody in your support network kind of help you with kind of prioritizing your sleep? That could be, kind of step one. Healthy eating, obviously, and staying hydrated. That's really important. Gentle exercise. It doesn't have to be anything stressful. Just going for walks. There's lots of different kind of yoga or different gentle exercises on YouTube that you can just kind of take maybe 10 minutes to do that. And we know that exercise obviously is very important for all aspects of our body, mind, all that kind of stuff is really important. Mindfulness, relaxation techniques, if this is something you're interested in, deep breathing, meditation, guided imagery. There's lots of really beautiful guided imagery on YouTube that will guide you through it. They're quick, again, like 5-minute thing. Mindfulness practices to stay grounded and be present. Journaling. Journaling or voice journaling, I found, is kind of getting more popular. So again, it's really hard, especially with a little one, to sit down and, okay, I'm going to journal. We often don't have time for that, right? So everybody has their phone. You can do kind of voice journals to yourself, right? Journal entries, just sometimes getting it out, what your day looks like or what you're really struggling with that day. If there's no one to talk to, if you're not connected with any kind of support or counseling, just speaking about it yourself and releasing it can actually have some benefits. Take breaks into smaller steps. Take one task at a time, whether it's caring for the baby or taking care of yourself. So that can look like, you know, a simple task of I threw in a load of laundry today and I got one load of laundry done. That's the task. That's what I got accomplished today, as well as caring for my baby. So just break them down into very smaller steps, smaller tasks that can help you feel accomplished. I got the dishes done in the sink. That was my goal for the day. I got it done. So you can feel some kind of accomplishment and proud about that. And then ask for help with household tasks or baby care. So if someone's coming over to wants to help, maybe they can hold baby and play with baby while you get the dishes done, because that's really important for you. Or they can get the dishes done while you care for your baby, whatever feels comfortable for you. Building a support network. So reach out to loved ones, lean on partners, family, friends for emotional and physical support. I've talked about join support groups, online or in-person postpartum anxiety support groups can offer validation and understanding. Speaking with others who have experienced similar struggles can be really comforting. Professional support. So there's lots of different counseling options available, lots of different therapy. Can be group therapy, individual, cognitive behavioral therapy, which is CBT, is great for anxiety. Doesn't work for everybody, so it's not necessarily a go-to, but could be really helpful. They're very, it's usually very quick, and typically only takes a few sessions sometimes with CBT. Postpartum doula or counselors, like I said, there's lots of different ones out there, some at a lower cost or pay what you can. Some are, if you have benefits, then some benefits can cover the cost. So when to seek professional help. So if your symptoms persist, if anxiety lasts beyond a few weeks, I would even challenge that to say a few months, or gets really worse. So if the anxiety affects the ability to care for yourself or your baby. So again, having a newborn, all of the stuff that goes along with that, most people have some level of anxiety, right? That's kind of normal. When to get some help is when it's not going away, right? After a few months, and you're sensing that it's getting worse and worse and worse, right? That's kind of when you're struggling to take care of your baby or yourself, then I would recommend you seeking some help. Signs of professional help is needed. So you're having some really intrusive thoughts or panic attacks start happening. You're having some difficulty bonding with your baby. You're having some feelings of hopelessness or depression. And you have some self-harm or thoughts of harming others. So those are some really important signs that you really do need to go talk to your doctor kind of immediately, right? If you're having any of those ones. So some common myths about postpartum anxiety. I should just be able to handle it. So that's a myth. The truth is anxiety is a medical condition, and seeking help is actually a sign of strength. So again, really important. We shouldn't be able to handle all of it, especially if it's your first baby. Like I said, they don't come with a manual, so we're trying to figure it out, right? So nobody's able to handle it all, right? It's just the baby blues, and it'll go away on its own. So that is a myth. Sometimes, we have some baby blues. If postpartum anxiety can persist and may need to be treated. So again, like I talked about in the last slide, if it's persistent and it's getting worse, it's not the baby blues. It's not your body adjusting to having a new baby, right? That's postpartum anxiety, and that needs to have some treatment. If I'm anxious, I'm a bad mother. That's a myth. Obviously, anxiety does not mean you're a bad parent at all. It's a very common and very treatable condition. So do seek help, or do try some of the strategies, and it can be treated, right? So some final encouraging words. Obviously, you are not alone. Many parents experience anxiety during the postpartum period, and help is available. It's okay to ask for help, whether from a therapist, your partner, a friend. You do not have to do it alone. And healing takes time. So be patient with yourself as you navigate this challenging time. Motherhood, all of the things that go along with it, although wonderful and exciting, it is really a challenging time in your life. And so everyone faces challenges. Everyone has days where they struggle. So just know that it does take time, and it's not something that is fixed overnight, right? It's not something that's just going to go away. It takes time for your body to readjust to having a little one, mentally and physically. So in conclusion, just a little summary. I'm at the 20-minute mark. So postpartum anxiety is real, but it is manageable with the right tools and support. Prioritize self-care, build a strong support system, and seek professional help when necessary. If you or someone you know is experiencing postpartum anxiety, reach out to your healthcare professional. Encourage open conversation about mental health in the postpartum period. Then I have some resources here. There's a Canada crisis number if you do feel you're in crisis, the mental health crisis line for Canada-wide, Simcoe County crisis line if you live in Simcoe County, 24-hour crisis line. There's the Trans Lifeline. There's Perinatal Wellbeing Ontario. There's their website. And there's Orillia Soldiers Memorial Hospital has the perinatal mental health. So you can access any of those if you're struggling, and they can connect you with different supports in the community. So thank you for listening, and I hope you enjoyed it, and stay tuned for the next micro learning session. Thanks. Have a great day.